All right. Thank you all for joining us today for this very important call. And thank you, Katy Jacobson, County Commissioner Katy Jacobson, for taking time out of your busy schedule. I can't imagine how busy you've been. And recently just got out of a late-breaking meeting. So I'll turn the time over to you, and then you can introduce who you've got on the call as well. So thank you for joining us.
Thank you. Thanks for having me here. So this is Katy Jacobson. I'm one of the Lincoln County Commissioners and the chair for this year. I also brought our Public Health Director, Rebecca Austin, who I believe is on the call. And it's Sarah Means from the Governor's Office and the Regional Solutions team who we've been working with on this. And I also earlier thought I heard Representative Gomberg's voice. So I think he is, oh, there you are. So I think he is here as well. So we do have quite a few people that can hopefully help answer questions today. I think a lot of you are business owners that will have a lot of business-related questions, which is why I invited Sarah here, because a lot of the guidance on businesses is coming out from the state, not the county. But I will just start with kind of providing a general update on where we are at with reopening, which I think is what most people want to know. We had our Lincoln County Board of Commissioners meeting today at 10 that went past the 11 o'clock hour or thereabouts, so we just kind of got out of that. We discussed several things around the COVID-19 situation. We basically went through line by line the criteria that was outlined for us by Governor Brown for what counties have to do to reopen, as well as what regional criteria has to be met to reopen. So just to be clear, there's county criteria you have to meet, and then there's regional criteria you have to meet. And we are in the Lynn, Lincoln, Benton, Polk, Yamhill, and Marion County region. No, I did not pick that region. That was sort of assigned to us. So again, county criteria, regional criteria, and going through that with our health director, Rebecca Austin, we do believe that we currently meet that criteria. And so we did take a vote to basically allow myself and Rebecca Austin the ability to sign that application and represent the county to be able to sign that and get it in. We are working very hard on submitting the application and are hopeful that we will have that in by the end of today and at the latest tomorrow morning. Rebecca, is there anything you wanted to add in terms of the application piece and timing?
I don't think so, Katy. I think you pretty much summarized it, but we'll see if there's questions too around that.
Okay. Thank you. So in terms of, what everyone wants to know is a date, when would we reopen? So again, this is a new process for us, new process for the state. You can see applications on the governor's website as she receives them. They basically hit her website, so you can go look at them there. You can see which ones are kind of in review. Some counties did provide a date in their application. In fact, some counties applied weeks ago when it wasn't even open to apply. So some of them have dates like May 1 or whatever on there that obviously were denied. Other counties, ones that have applied kind of more, not a while ago, but as of Friday or over the weekend, many of them actually do not have a date on there. And Lincoln County is taking a similar approach. We are not putting a date on our application. And the reason why we decided to do that is we ultimately do not control that date. Our application has to be reviewed. The information has to be verified. And then we were told that we passed muster essentially. So we put it in without a date. And process-wise, once we hear back that, that we are approved, we would hold some type of emergency meeting with the Board of Commissioners to basically decide when we, want to reopen or how we would proceed from there. So that's kind of the process that was decided on this morning. And like I said, that application will hopefully go in later today or early tomorrow morning. So that's kind of the general update. There is lots of guidance for specific sectors coming out from the state. My understanding is more guidance will come out this week. It will kind of keep coming out. So we do have that posted on the Lincoln County website as well. So if you're looking for, as a restaurant owner or whatever, what you need to do in order to reopen at a business level, that guidance is up and you can look at that. And now moving to kind of a totally related but sort of separate issue is the lodging order that both the Lincoln County Board of Commissioners, City of Lincoln Cities, Newport, Depot Bay, Yachats, Wellport, Toledo, and Siletz put into place. That order extends until May 31st, and it's scheduled to basically retire itself. We have a meeting coming up on, let me make sure I have the right time here, Thursday, May 14th, 2020 at 3 p.m. Again, a virtual meeting. We're having a special meeting again with the Lincoln County Board of Commissioners and the mayors, city councils, and city managers of Lincoln City, Depot Bay, Newport, Wellport, Yachats, Toledo, and Siletz to discuss Order 420-118 and a framework for reopening short-term rentals and other lodging accommodations in the county. So as we are working on getting our application in, hopefully by Thursday it would be in, to reopen according to the state guidelines. We're also going to have conversations on Thursday about the city and county order about lodging. Anything you wanted to add from the state end, Sarah?
I'm trying to respond to some questions in the chat box, so keep them coming. That's helpful. I think, Commissioner Jacobson, everything you said is true, accurate, and a good update. I provided the link where you can all go to look at what counties throughout the state have submitted their applications for reopening. So take a look at that. We're planning to announce what counties do get to move forward as of May 15th later this week. Nothing is scheduled yet, but stay tuned. And we will be getting additional sector guidelines this week as well. Childcare, transit, I'm just reading from my list to make sure I don't miss them. Childcare, transit, summer youth programs, that's sort of lumped into childcare. And then also gyms is coming out this week. So there's a lot of information that's going to be disseminated this week. And hopefully you all, as you need it, will receive it, and certainly know that we are a resource for you if you have questions.
As far as kind of jumping into questions right now, there's one on, do you have a guess on the timeline to get approval? You know, I would really bounce that to Sarah and ask her if they have a guess of how long it's taking the state to move through those applications. I have the same question as this person.
A lot of people have that same question, and I was actually just typing a response, so I'll just go ahead and answer it. So once an application is submitted, it goes to Jen Andrews in our office, and she forwards it to I believe it's our health policy advisor that does a sort of a completeness check of the application to make sure everything's in there that is needed in order to move it forward. Once it's deemed complete, it goes to the Oregon Health Authority for review. Again, they're doing their best to turn these around very quickly. We received, if you go to that website, you'll see we received a number of applications over starting Friday and over the weekend. And so they're doing their best to move those quickly, understanding that we are, you know, our target date right now for a number of counties is Friday. So that's an incredibly quick turnaround. So in terms of timeline for approvals, I think that's dependent on each individual application and what the needs are, or if there are questions or things that need to be worked through. But just know that they are working as fast as they can to get these turned around so that counties who have applied and want to reopen can as soon as possible.
All right, another question was, will there be any further guidelines for, oops, question move here, for retail specifically outdoor shopping centers. I'm just going to go out on a limb and say that maybe that's the outlet malls in Lincoln City. I don't know that, but
yeah, I see somebody waving about that. Yeah. I actually might have some information in the, regarding that in my inbox. Let me look, and if I do, I will forward it on or even cut and paste it into the chat box if it's appropriate. But yeah, I think there is going to be a little bit more information there.
Okay, best case scenario, when will restaurants and hotels open? Hotels, again, the lodging order that cities and counties put in place expires on May 31, with the exception of Walport that only extended out to May 15th. My understanding is I think Walport is maybe meeting today or tomorrow to discuss possible extension of that. So I'm not sure exactly what Walport will do. There is a meeting this Thursday at 3 p.m. which will be live streamed from the city of Newport for all those bodies to discuss that order and possible reopening on June 1, as well as some criteria that a work group has put together for how those businesses would reopen with social distancing measures and the safety measures in place. So like I said, at this point in time, that extends till May 31. I can't really tell you a date or what that would look like because that meeting happens on Thursday. Though there should be some clarity coming out then. As for restaurants, that really depends on when our application would be approved from the state for reopening. That was a state decision to close restaurants, so they essentially have to reopen those. And once we hear that we have been approved, then the DOC will come back to a vote on a reopening day. So I can't tell you with any certainty what that day would be because we really just don't know yet, other than our application is being put in hopefully later today.
Hey, Commissioner Jacobson, I just want to point out, and I see Rep. Gomberg made sure that this was clear, and thank you, Representative Gomberg, for doing that. Excuse me. Applications for reopening are reviewed in the order that they are received. So just know that there were a number of them submitted over the weekend, but thank you again, Representative Gomberg, for reminding me to be clear on that. Okay.
Katie, if I could jump in for a sec here and give you a chance to catch your breath. One of the things that the Coastal Caucus has been involved with, and of course the Coastal Caucus are legislators from up and down the Oregon coast, senators, representatives, Republicans, Democrats. We have been urging cities and counties to act in a cooperative and communicative way to make sure that we have a united approach to these challenges rather than a more haphazard go-it-alone approach. I wanted to let you know, because I see people here on the call, particularly from North Lincoln County, that Tillamook County has also submitted their application to reopen. They're a little further up the list than we are, but their application is in. The situation in Tillamook County is becoming a little more complicated because, as you all know, the lodging question is being decided by cities and counties, not by the state. And in Tillamook County, the city of Tillamook has voted to open up their lodging, but the county of Tillamook has not. That's creating a little bit of confusion, but also maybe having some effect on the coast as a magnet to people from the coast who are traveling out here in increasing numbers.
Thank you, David. Question, what is the suggestion for retail clothing footwear as it relates to products that would normally be tried on once reopened? Sarah, do you guys have guidance on that?
Yeah, I mean, not really. What I saw this morning related specifically to that was that they actually don't believe, there's not a huge concern at this point with public health officials. And Rebecca, if you've heard anything different, please correct me. But what I read this morning is that they're not, the transmission on clothing is something that they're not overly concerned about. They're asking that it's limited, and if there is folks trying on clothing or footwear, that maybe perhaps those particular items are set aside for a day or two, so that there's some level of precaution there, but we don't have anything more than that in the guidance. And I know that it isn't overly helpful, but that is according to what I read this morning.
Okay, the local workforce boards have funding available to help train and place contact tracing as their coordinator effort by the state to help identify training in businesses who might be using contact tracers. I actually would first have Rebecca Austin from Public Health answer that in terms of the contact tracers we have and that we have trained, and then I guess Sarah could answer as well.
So we do meet that requirement. We have been training other staff to become contact tracers. We have 2.5 people regularly that do this kind of work in our health department. We have trained 6 other nurses and our environmental health staff to do contact tracing. And then we are in the process this week of training 4 bilingual, bicultural people to help us out with contact tracing. So the requirement is that I believe it's 30 for every 100,000 people we have population. So that would mean if we have 50,000 in our county, we would need 15 people. Did I do that right? No, we need 7.5. So it's 15 people for every 100,000, and we need 7.5 people, and we have 11, something like that. So we're in good shape.
Sarah, do you want to answer the part about if the kind of state needs help identifying and training businesses for contact tracers?
That's really a question for Oregon Health Authority, so I hate to misspeak. I know that on a couple of the calls I was on last week with Director Allen of the Oregon Health Authority, he seemed to think that as counties perhaps might need assistance, further assistance, and Katy, you were on one of those calls, so maybe you have this information as well, but as counties need some level of assistance, or if they do with contact tracers, that the state would be able to come in and help with that. And so I know that they're bringing on staff and training up individuals so that we have that contact tracing ability and are able to respond quickly if needed.
Yeah, I would add that in a call with our health region last week, it was clear that Marion County needed some help with getting enough contact tracers. They have a much larger population than we do. So Heather, that might be a place to reach out to see if they need help with that. The next question I see here is, it seems like our biggest collective challenge as a community will be balancing our need and desire to reopen tourism-driven businesses while honoring state guidelines to individuals to avoid unnecessary travel. Who will lead our county efforts to deliver a united tourism industry message? As part of our emergency management team under our recovery response, we have brought on Chris Chandler, who used to work for Lincoln County Economic Development, who has been with Central Lincoln PUD for several years, but Chris is a certified economic developer. We have brought her on to basically create that kind of messaging around what it means to be a tourist these days on the coast. Chris is reporting directly to Commissioner Hunt. I know she has already provided some ideas and stuff to him directly, so we do have someone we have brought on board to do that, and we'll likely be using some of the TRT dollars to fund some of her ideas and the plan that she comes up with. And I would also say that I see Chambers playing a large role in helping roll that message out as well. Has there been any decision made to when social distancing might be lifted after some businesses are open? There is some guidelines in the phasing criteria given on when certain groups of people, quantities of people can re-meet. So I'll let Sarah kind of speak to that.
Yeah, so I think social distancing, physical distancing will be with us for a little while. Certainly through phase 1, in all of the guidance that we're seeing, that physical distancing, specifically 6 feet whenever possible, and then all of the other protective measures are being, if not required, strongly encouraged. We don't yet have all of the phase 2 guidance done. And so, you know, that there's a lot to be determined there still. What I will say is that, you know, gatherings and, you know, places where, you know, people will congregate, you know, all of those things are likely to remain limited even through phase 2. I think the number in the slide deck that was sent out, you know, it is contemplating increasing the gathering size in phase 2 to somewhere around 100, but that is very much still yet to be determined. And so you're still talking about relatively strict restrictions around mass gatherings, and that is really a direct result of needing to maintain physical distancing. So it's going to be with us for a while.
Thank you, Sarah. Next question.
So Commissioner, could I?
Oh, go ahead.
This is Rebecca Austin. If I can just interject in here, I think it's an important point that Sarah brings up, and that the phasing really is being very closely monitored. So when we enter phase 1, we will be watching to make sure that our COVID-related illnesses are not spiking and that people aren't showing up at our EDs, our emergency departments, or being hospitalized for COVID illnesses, or that we're having outbreaks in certain areas. So as long as so that's why it's really important, this whole reopening thing is, in a campaign that we're starting to work on, is that we're kind of all in this together and we all need to be pulling our weight, because as soon as we start seeing spikes in COVID, we will be going back down to a more closed down position. So, and we have to maintain phase 1 for 21 days and not show that we are spiking in COVID related illnesses. So that is really crucial. So I think that's the important part. We really want the chambers to understand that this is a fine wire that we're trying to balance ourselves on. One is that we do want to get our economy back up to speed, but we also need to do it in a safe way so that we don't have these spikes in COVID illnesses.
Thank you for that, Rebecca. I would also just add that, you know, testing will continue to increase. We've seen an increase in testing in Lincoln County. And so as Rebecca tells me in just about every phone call, she hasn't said it in this one yet, so I'll say it for her, but we likely will see the numbers of positive tests increase as we have more testing done. And so we likely will see additional positive tests coming up, and really we need to make sure that as we test more people and we see a potential increase, that that is proportional and that we're not seeing this huge influx in cases that can't be accounted for simply by doing more tests. Another one for Rebecca here, and it looks like Tyler posted the retail specific guidance in the chat box, so that's up there. Another question for Rebecca: will the county need to do a physical inspection of businesses to make sure they're compliant, specifically restaurants?
Our environmental health inspectors will be out and about. We're not exactly sure yet if we're going to require a plan before they open. It all depends on what the timeline is, but we are certainly available for consultation. And if we get complaints, we will be showing up and doing an inspection. So yeah, we're going to try our best to do what we can to make sure that people are safe when they do go into restaurants.
Okay, thank you. It's Steve Back. I am confused. Did Representative Gomberg say that the opening for restaurants is a city and county call, not a state call? I'll let Representative Gomberg clear that one up.
Thank you, Katie. Yes, we posted back into the chat section. The restaurant decisions are made by the state. The lodging decisions are made by cities and counties.
Yep, great, thank you. Is it a violation to accept customers by appointment in retail businesses if we require masks, etc.? My understanding of that is no, but I will let Sarah confirm.
Yeah, I would agree with you, Commissioner. I think as long as you're complying with the physical distancing standards and the requirement to wear masks, and just, you know, your general sanitation protocols, by appointment should be fine, as according to my read of the guidelines.
Yeah, this is Rebecca, and if I could just interject, one of the reasons for allowing a by appointment is because you can't, we're sensing that you can manage that 6-foot distance and people can be prepared and wear masks. I think our big challenge is for businesses that will be opening soon, hopefully, that this is the perfect time for you to begin to figure out how you are going to manage that. And there's lots of information out on the web. Different decals you can get to put on your floors that keeps people distancing. If you want them to go in a one-way sort of path through your store, you can get those arrows out. So people really need to be aware that they need to be thinking about this, because we're not going to be successful if everybody starts opening up and you disregard the 6-foot distancing rule and the mask wearing. We're not going to be successful. So that is something that businesses could be doing right now, is figuring out how they are going to do that. And it's very clear in the guidance that they need to figure that out.
All right, someone wanting the link for the May 14th, 3 p.m. To discuss lodging. It's kind of difficult for me to grab that right now and kind of facilitating this call. But if Tyler's still on the phone, maybe I can nicely ask him to go and grab that off the City of Newport website under meetings. There should be the place where you would go and grab it when the link is actually up for the live feed. To be clear, do all counties in our region need to comply before we are allowed to move towards opening? Rebecca, do you want to take that one?
What's the question again?
The question is, do all counties in our region need to comply before we are allowed to move toward opening?
Oh, yeah, sure, I can take that one. So there are certain areas that we need to comply with regionally and certain areas that we need to comply with county. So the county ones are that we have the contact tracers, and I've already reported out that we do have that. The other one is that we have alternative isolation facilities available, and we probably will be contacting some of you, maybe even on this call. In Lincoln City, we don't have any housing set up yet, and we would like to. We have quite a bit in Newport, but we would like to get some housing set up for the rest of the cities, the jurisdictions in our county. So if we do have to house somebody, for example, a healthcare worker at your hospital gets sick, doesn't feel like they can go home to be isolated, they would need a hotel room to isolate in. So we really are looking for that, and you may be called upon to help us out with that one. So we feel like we have the rooms, we just don't have them where I would like them to be most convenient for everybody. So we do comply with that rule, and then we also have to say how we would address any large congregate setting kind of settings, like how would we respond to an outbreak in a long-term care facility, in the jail, in the county jail, and in, say, a manufacturing plant that has an outbreak. And so we can write to all that. We have experience with most of that. And the sheriff has put in a really good plan at the jail. So we're feeling confident we can meet that one. And the last one is that we have to be able to provide the personal protective equipment, or the PPE, to our first responders. And we're feeling pretty good that we do have that stockpile ready for them to share with them as well. So we do not have PPE for businesses. So that is going to be something that people are going to have to be thinking about when they bring their staff back on. You know, if you can't maintain that 6-foot distance, then wearing masks is the next best thing. So making sure that your staff have those masks. I know it's a challenge working all day with a mask on. So trying to maintain that 6-foot distance is probably the preference. And then the regional things that we will be judged against, we're sort of feeling like we are doing pretty good there. Let's see, those are the testing. So every county in our region feels like they can meet the testing requirements. So that's good. Everybody has really been ramping up on that, and more labs are coming online and more kits are being available. So we're feeling good that we will meet that as a region. The other one is that all of our hospitals have to be able to accommodate a 20% increase in hospitalizations. And I think even Marion County is in pretty good shape there. So we probably meet that one. We definitely do in our region, our usual Samaritan region, Lynn, Benton, and Lincoln. Because we haven't had anybody hospitalized in Lincoln County with COVID-19. So we're doing pretty good. And then the last one is that they have some requirements they have to meet also around the PPE. And they have a little bit different system than we do. It's also out of the state, but it's not something we're managing. So they are writing to that. And I'm thinking they're all in pretty good shape there too. So it seems like that we meet all those requirements. Now we just need to get our application in and really start messaging to the public how we're going to do this in a safe manner. And hopefully the state will allow us to open soon.
Yeah, and just to provide some clarity on the question, do all counties in our region need to comply before we are allowed to move towards opening? There are county criteria and there's regional criteria. And yes, as a region, we have to meet that criteria. So if we have a weak county that doesn't meet the regional criteria, then that is a problem. And I would say that's one of the reasons maybe it took us a few extra days to get ready to submit that application, because we had to make sure that as a collective group, we could meet that regional criteria.
If I could jump in on this for a second. Yes, much of this is going to be on a county by county basis. But again, I would emphasize that it makes some sense for the Central Coast counties to be communicating with each other, because if there are different rules in Clatsop than in Tillamook than in Lincoln, then it gets very confusing for people who are interested in coming out to visit us here. The other thing that has generated a certain amount of confusion has been the regional health or hospital districts, where Lincoln is in the same district as Marion County. Low exposure Lincoln, high exposure Marion, just as we've got Clatsop County that is linked together with Multnomah County. And there has been some concerns about how that is going to play out in the review process. I don't know if Rebecca or Sarah want to comment on that aspect of the question.
Well, again, I think Katy did a nice job of summarizing the requirements that have to be met regionally. And if Marion County can't get their testing up, or they don't have the 20% surge capacity in their hospital, we will not get approval. So, but like I said, we have been in contact with all of our partners, and everybody, the regional partners are feeling pretty good about their regional requirements. And so now really what we're focusing on is to make sure that we have our county requirements, that we can meet those.
Okay, how closely is the county monitoring the lawsuits in LA County with the restaurants suing the county over this? It's a county issued order, loss of income. Yeah, so restaurants were closed by a state order, not a county order in Lincoln County, but lodging was closed by county and cities, and we have had several threats of lawsuits already, been sent to us. So we're going to have to go through that as well. While listening to the BOC and cities meeting last week, it was a couple weeks ago, to push the closure of leisure out to May 31st, I was under the impression that it could potentially be amended at a sooner date than the end of May. Is that still a possibility, or is there no chance that a decision for reopening will be made until then? Businesses will need some advance notice to bring employees back. So when it comes to lodging, The lodging order that cities and counties put in, again, we are having a meeting Thursday, May 14th at 3 p.m., which will be live streamed through the city of Newport, that will basically be discussing that order. I am concerned about the justification for the 10 p.m. curfew on on-site consumption. Being told bars won't be what they used to be, and people cannot be trusted to, it says shave, I'm assuming that was a typo, responsibly is concerning. Even more concerning is this curfew applies to establishments that do not serve alcohol. How long can we expect this curfew to last? After 10 p.m. is 60% of my business. I have never had issues with customers being overserved. That seems like a state question, so I will kick that to Sarah.
Yeah, I mean, definitely it is a state question in regard, you know, it's coming down from the guidance for restaurants. And I know we've been hearing a lot of concerns about that 10 p.m. curfew. Rebecca might be able to address more of the public health side of that concern, but from what I've been told, you know, there was a concern about folks being out in bar. Really, the concern was bars, and I believe with the federal guidelines, bars weren't even considered to be open. If I'm hoping I'm not mistaken there. So we're trying to get more opportunity and get more folks opened up as best we can, but also acknowledging that we're really leading with a public health aspect of this and need to be very cautious about that and the data that the public health officials are giving us. I think after, when is the curfew, or how long is the curfew expected to last? You know, this is those are phase 1 guidelines. And so, you know, they certainly will last through phase 1. At this point, as my understanding, it's, you know, we have not developed phase 2 guidelines for restaurants at this point. So I would expect that this would at least last until or through the end of phase 1. And Rebecca, do you have, could you more eloquently speak to perhaps from a public health perspective, the curfew, or I don't know if you have anything additional for that.
You know, I don't know how much more eloquent I could be, Sarah, than you actually, but I think it's important.
Kind. That was not overly eloquent. You're too kind.
I think it's important to remember here that we're all sort of flying this, building this plane as we're flying it, as they say. So we've never been here before, and we're really trying to, and I really appreciate the governor wanting to pay attention to the science as we do move into opening up our economy. I do think probably the bar concern is, that 6-foot distancing. And of course, if you're in a bar, you're not going to be able to be wearing a mask. So I do think there's special considerations that we have to have with the bars. So I would just say, try to be patient with us as we kind of figure this out. And hopefully during phase 2, we can see some expansion moving forward here. But, it's just really, we're going to have to see. I mean, I'm just trying to get into phase 1 so we can start seeing really what's happening. And every day, just so you have my perspective, every day something else comes up that we hadn't thought about, or that we like, oh gosh, now what? All these people are coming in to do this normal work that always happens in June. And it's this influx of people into the community from all over, not just all other states that are much higher risk than we are, but all over the world, So you can imagine how, I hate to say freaked out we get, but we are a little bit concerned that we are moving into a reopening of our county. All these people are going to be coming in, and are we going to be able to manage that without risking people's lives? So that's kind of where we're coming from. So I think you're going to have to be patient. I certainly understand the impatience, though, and the economic hardship that it's causing a lot of you out there.
Okay, next we had several questions on masks So if you require customers to wear a mask, do you have to provide the masks? And then additionally, if you, you know, have if you mandate mask wearing with employers, do you need to consult an attorney? So I guess just kind of a generalized question, maybe back to Rebecca, is if you're making the public wear masks in your establishment, do you need to provide those? We have clarity on that?
Does the business need to require to provide those? Is that what the question is?
Yeah, so if you're making your, we have two different questions. If you're making your customers wear a mask, do you need to provide them? Kind of a legal question, I think, maybe. And then the second one is if you're making your employers wear a mask, kind of is that legal, or do you need to consult an attorney?
Yeah, I'm not an attorney and I don't really know the answer to that one, but I would say that requiring masks is something that we're trying to work on at the county level. We're doing a mask-a-thon right now to try to get more people to make the cloth masks so that we can get them out to people. It's not something that we're taking on as a requirement for businesses to open, but more as a, you know, we want to help you out kind of thing. But I would say that businesses should really be looking into that. And, you know, it's going to be hard to find, you know, the paper products for sure. So I think the cloth is our next best option. So I would, yeah, I mean, that's going to be our scramble for the next few weeks is to, everybody should be looking for how they're going to resolve that. And we're hoping that everybody has their mask. I mean, I don't know about you, but, you know, I have two right now, one in my car all the time and one in my coat pocket. So that's just how our lives are changing. So I would suggest that most people get prepared.
All right, thanks, Rebecca. Will restaurants in Lincoln County have to wait until restaurants in Marion County reopen, or can Lincoln County open without other counties opening, or do all restaurants in all counties group? No, we just have to meet that regional criteria. So as long as when our application is reviewed that OHA says, yes, you meet your regional criteria in terms of surge capacity and hospital beds and the regional criteria for testing requirements and other regional criteria, it doesn't matter when one county opens or not. We don't all have to open as a region on the same day for restaurants or any of those phase one things. We just have to meet the regional criteria. So it is completely possible that counties within our potential region open at different times. I agree with Representative Gomberg that having some coordination, especially on the coast, even though we're the only coastal county in our region, is helpful for kind of tourist management, but we don't have to open at the same time as other counties in our region. We just have to meet that regional criteria in order to open. For clarification, a target date of Friday was mentioned. Does that mean best case target date for eligible businesses to open on Friday? So the governor's office put a target date out of May 15th, which was Friday, that some counties would be able to open. We do not know if that means Lincoln County would be in the grouping or not. Hopefully our application will go in today. Part of that would maybe depend on how long it takes to review. There is other applications ahead of us. And then also the BOC would need to vote back when we hear that our application is approved on a reopening date. Has the stay-home plan been effective? It seems to me that the number of new cases daily has not been declining. Are there any actions being enforced concerning people who go out knowing they are sick or exposed, or do you think that has been a problem? I'm concerned about the second wave being more deadly than the first. Yeah, good question. Rebecca, do you have some kind of public health comments around that, I guess?
Well, let's see. Has the stay-at-home been effective? I would say very effective for Oregon. And up to about this past weekend, I think on the coast, we have done a really good job. I mean, there have been, we have had problems on the weekends, but so far it has not caused us to have any more a spike in disease. So that's nice. So I would say yes, we have been very successful in Oregon, and we can be proud of that. Are there any other, well, we were just talking to the sheriff today about that in the Board of Commissioners meeting about enforcement. And I think we'll have to kind of see how that goes, but we do want, you know, there seems to be this two-sided shaming going on. Either you're shamed because you have a mask or you're shamed because you don't have a mask. So we would like to not do shaming, but really get everybody, and I think our campaign that we're starting about it takes us all together, working together to keep Lincoln County open is going to really help people. So we have just 3 simple messages. One is to do the social distancing. The other is to wear a mask and do the cleaning that's required. And the last one is, oh my gosh, I'm spacing it out. Help me, Katie. What's the last one that we're trying to do?
Sorry, I was multitasking and
Oh,
looking at
you
the
were
other
multitasking. I just spaced it out and it's not going to come back right now. So anyhow, there's 3 messages that we want to get across. Very simple. And you'll see that we should have sent out a packet to everybody. I'm hoping the chamber has that packet, and that the city, Lincoln City also has that packet that you can get our campaign posters to put up in your stores. You can get posters that are specific to about the symptoms, because I think that's another thing that you have to make sure your employees all understand what the symptoms are of COVID-19. So we have that poster that you can put up. We have a lot of materials, both in English and Spanish, that we are hoping that everybody will get posted, so that, because this is going to be a joint effort. And I think that you will be seeing some kind of enforcement going on. I don't exactly know how that looks right now. And just to remind everybody, our public health our whole department is about 23 people. So, you know, monitoring this is not going to be something that public health is going to be very successful at doing. So just keep that in mind. So a lot of self-monitoring and really encouraging people to do the right thing. We are working with long-term care facility staff right now to get them to wear some kind of button or something that identifies them out in the community, that they are taking care of our seniors. And so people need to be respectful and wear masks around them so that they don't get sick, because if we get an outbreak in our long-term care facility and staff are involved, that will be a really devastating thing for our county. So we'll just see how the enforcement piece goes, but we're really trying to push this campaign that it's everybody's responsibility to keep everybody safe.
And Rebecca, we had a specific question just come in about long-term care facilities. The person said, as one of 5 local long-term care facilities, we are very concerned about the safety and health of our residents. Can you tell us which phase our facilities will be able to open to the public and families?
Oh gosh, that might be a better Sarah question, but I'm not sure I saw that in phase 1 or 2. So I think that's later down the road.
All right, I was multitasking. So which one were you looking at, Katie?
The question was basically, can you tell us which phase that long-term care facilities would be able to open to the public and to families?
Let me look real quick. I want to say something, but I don't want to say it.
Okay, we'll let you look that up and we'll circle back. There's a lot of questions and I'm running out of time, so I'm kind of trying to go through and squish some of them together and prioritize here. Thank you, Tyler and others who posted the link to the City of Newport meeting on Thursday. There's also a comment here of a place you can call with companies that are making wholesale masks. So if you're a business and maybe need some of those masks, go look at the comments. There's a phone number posted there as well. Also a question on wanting to restate the county-specific criteria for reopening versus the regional criteria. We do have that up on our webpage. Thank you, Dave, for posting that. It's also up on the governor's page as well, what that criteria is. So that's up there. If you want to listen to a really long meeting, the BOC meeting we had earlier today at 10, which was recorded, we went through that criteria basically line to line together with Rebecca.
So,
all right, Sarah, did you go ahead?
Yep. So within the new guideline, or excuse me, framework released late last week, under phase 2 in the slide deck, it says we want to begin to allow visitation to congregate care. So that is right now identified under phase 2.
Oh.
But I will just reiterate, we've not actually formalized those guidelines for phase 2 yet. So just please do keep that in mind.
Another question on, is there guidelines to open group gatherings for funerals, weddings, or religious services? Sarah, do you have some guidance on that?
We are in the process of developing that guidance. So again, that's not a phase 1 situation. So potentially have that ready for a later phase. Again, the phase 2 gathering number is estimated at around 100. That is likely to change in some way, shape, or form, but that's the number that our office did put out there. So there was some guideline there. That's all in phase 2.
And then a question from earlier that I missed was, should we assume that some shutdowns will remain until we get a vaccine for COVID?
Yeah, I think in the, again, in the slide deck, there's, let me find it. Sorry, I just clicked off of it.
Okay, thank you.
So, in the slide deck, it does specifically talk about, and I'll post this link into the comments here, but really all large gatherings should be canceled or significantly modified through at least September. And, really we're talking about the need for a vaccine is really needed so that those sorts of activities can start to take place again.
Okay, I think we made it through most of the questions, or at least pieces of those questions that I kind of lumped together. I was just going to turn it back over to Representative Gomberg real quick and see if he had anything he wanted to add.
Well, thanks so much, Katie. First of all, thank you everybody for being online with us today and for being part of the effort to make our community stronger, more resilient, and more responsive. I've been saying that I think that reopening is going to be more complicated than shutting down was, and that's proving to be awkwardly true. I think it's also true that our communities are not speaking with one voice on these questions, and there are strong opinions that we need to be more guarded, that we need to restrict travel, that we need to minimize visitations and interactions. And on the other hand, we're hearing from lots of people that we need to open up now, that our businesses are at risk, and that we need to be taking steps to focus on our economy because they believe that the health situation is under control. I think there's some truth in both perspectives. I think there are some errors in both perspectives as well, and that it's important that we move forward cautiously as quickly as possible so that we don't get a resurgence of this virus that's going to require more closures and the economic suffering to go on for a longer period of time. I think the main thing I have to say at this point is that that we're at a critical point right now, and it's important that we not become complacent, that we not let down our guard, because this thing could pop back up again. And if that becomes the case, then we're facing a whole new slate of problems and ongoing suffering. So Not all of the answers are good ones. I appreciate some people raising questions. For example, the hospital districts and whether we should be lumped together with larger counties in the valley that have higher exposure rates than us. Some of the proposed rules, like the one for the 10 p.m. closing of restaurants and bars, that's I think I would be charitable to say that's a debatable proposal, and we need to make sure that we're taking steps that make sense, that also keep us safe but don't unnecessarily hinder our economic circumstances. So there's a lot going on, Let me close with one piece of, I think, really good news. Senator Johnson shared this morning that through her efforts that a plane landed at Portland International this morning with 1 million more masks for Oregon. So I'm expecting that those resources are going to get out to all parts of Oregon and help answer some of the questions that you've had about where this stuff comes from. If anybody's got any specific questions, please let our office know. Tyler from my Chief of Staff has been online with us today, posting a lot of stuff in the chat sections. Thank you, Tyler. I particularly appreciated the remark that we all need to shave responsibly. I've been following us on Zoom meetings, and I'm not sure we're all shaving responsibly, but maybe that was a typo, maybe not. But I certainly wish all of you a good week, and I think things are getting better. Some would say not quickly enough.
Thank you, Representative Gomberg. One thing I will just add is a reminder that we do have a call center open in Lincoln County for COVID-related questions. So if you think of a burning question afterwards, you can pop it in there. I will type it into the text box so you have it. We have an email, but also a call center. It is a remote call center, so you call, leave a message, and they call you back. So that is a resource as well. I would also say that inboxes into myself and other commissioners, as well as local elected officials, are really, really, really full. So I do apologize in advance that I'm usually not able to move through those very quickly. But if you have a burning question, sending it to the call center is a really good idea, because a lot of times they have those resources at their fingertips. They can help provide those for you. Anything to finish up you wanted to say, Rebecca?
No, I'm good. Thank you, Commissioner.
Okay, anything from Sarah?
No, nothing more. Thanks, everybody. And I appreciate the level of concern from all sides of the conversation, and just know that we are doing our best. And if you need anything, please don't hesitate to reach out to me directly. I'll make sure my email is in the chat box.
And then anything from you, Lori, as Chamber Director, you wanted to say before we end?
Yeah, just wanted to thank you so much for taking time out. I know it's been fast and furious. You're great at multitasking, reading all those questions, answering. Just, I put something in the chat, just got an email. It's been determined that retail will now open statewide on May 15th from the governor's office. So that's great news. I will be sending out information regarding that. And from the chamber standpoint, we're here to help in any way possible. We've just been trying to get the information out fast and furious. So I know everybody's trying to keep up on it as much as possible. So please let me know if we can do anything, if you have any ideas of how we can help. And thank you so much for being on the call. It's been recorded, and it will be on our website and social media probably within an hour. So yeah, once again, just thank everybody for being on the call.
Okay, thank you. Bye, everybody. Take care.
All right.
Be safe.
Bye-bye.